Hi, I'm Dr. David Lang with Lang Chiropractic Center here in Athens. We want to go over some neck exercises. These are very basic, simple neck maneuvers that we can use at home. It's stuff that we can go over with patients. We typically go over with them in the office, but these are also things that we want them to do at home. So hopefully this video series will have a more of a detailed explanation of exactly what you need to be doing and how the exercises should look, should you have not quite grasped it at the office. All right, so what we're going to start with our first exercise for the neck are called isometrics, okay? Now an isometric exercise is one in which the muscle contracts but the joints do not move, okay? So you don't want to see movement of the head or neck during the isometric contraction, okay? And this is going to be great for building and stabilizing the deep muscles of the neck that don't get exercised a lot during the day. Those that are stagnant, those that stretch out or shorten or tighten because of periods of long sitting or immobility, okay? So McKenna here is going to demonstrate how to do those. McKenna, let's start with isometrics on the side, okay? So with these, you're going to go to every side. We're basically going to go all the way around the head with these. She's going to start on this left side. So what we'll do is you'll put a hand against your left side of the head, and you'll push your head against your hand, and you'll push your hand against your head. So these two forces are coming together, but you notice there's no movement in the head or neck, okay? So she's contracting the muscle, pushing it against the hand, making this side of the neck contract, and that gets to the deep muscles of the side of the neck, and it begins to strengthen those, okay? And you hold that for a few seconds, 5 to 6 seconds, and then you let go. And you're gonna repeat that 5 to 6 times, okay? Now let's go to the other side. Every time you do one side, you wanna just in turn follow it with the opposite side. So on the right side here, she presses her hand against the head, her head back against the hand, and she's using the muscles on this right side, the deep muscles in the lateral neck here, okay? Notice there's no movement of her head, there's no bending of the neck. The neck is remaining still and stable. This forces the muscles again to contract against resistance, but not allow the head to move. Now, if your neck is really stiff, okay, very good. If the neck is very stiff, this is going to give you more range of motion. It's going to open up the range that you're going to be allowed to move your head. Okay, now let's go to the back. Okay, go straight back to the back. So what she's doing is pressing her head against her back of her hands, and then her hands are pressing up against the back of the head, but notice again, there's no movement of the head or neck, okay? So she's contracting all the muscles in the posterior neck, the back of her head here, and trying to make the head come back, but the head's not going anywhere. Again, this strengthens the muscle. Okay, now McKenna will do the very front. Now the very front you can do with one hand or you can do with two hands. Just depends on if you can't get your shoulder up high enough to activate it. So for the front of the neck, you press your hand against the front of your forehead in the very center. Okay, and then you press the forehead against your hand, hand against the forehead. But then again, we're not moving the head. The head is in a neutral position the whole time. This activates the muscles on the front of the neck, including the scalenes and the SCM strap muscles that control stability of the neck, okay? Very good. Now, one last component. We did all the way around the head, but one component people tend to forget is rotation of the head, okay? So we also want to resist contraction against rotation. So McKenna, if you'll pick a side there, try to rotate your head. So what she's doing, she's not trying to bend her head to that side, she's trying to rotate her head to that side, and she's blocking it with the hand here, okay? So rotation is a very important component of the neck. If you think how many times throughout the day you turn your head, it's quite a bit. So now we'll follow that with the opposite side. Very good. So what she's trying to do is she's trying to rotate her head against resistance, not allowing the neck to rotate. Very good. And these exercises right here will attack the stabilizers of the neck. So this is the very first thing that we prescribe when we're either treating just standard general neck pain, or if we're taking a patient through corrective care where we're reestablishing the proper curves in the neck. Okay, so one common position that we get in is if we're at a computer, we notice our head going forward, our shoulders rounding off, and our neck gets really tight. So we end up at the end of the day with tense traps. So what this particular maneuver, this is called a chin retraction, and this maneuver here is going to activate the muscles on the front of the neck, okay? And it's going to activate those joints to move, okay? So we start a chin retraction by just bringing 2 fingers up and placing them on the chin, okay? Now, when we do this, we want to leave these fingers in this position without moving them. And then what she's going to do is try to stack each bone in her neck all the way up to the back, keeping her head slightly flexed forward. There we go, stacking it. And now all the way back out to touch the fingers. So we're stacking the head and back forward. And then all the way back, stacking it real tall. There we go, and back forward. So this is a stacking and a moving and a jutting forward of the neck. This activates the front of the neck muscles, okay? And these are the ones that typically shut off during the course of the day as we're in seated positions for extended periods. It's also a great maneuver to do if you're rehabilitating from a neck injury. Chin retractions will reduce forward head posture, which is something that a lot of us have since we're looking at phones and tablets most of the day. Anytime you walk around, if you're out in public, just look, you'll see someone looking down at a phone. And so chin retractions will help to bring the head back and reduce forward head posture by strengthening within that plane of motion. Now the next move we're going to do here is lateral bending with rotation of the neck. Once you've done your isometrics, you've then followed those with the chin retractions. The next move we want to do is start getting some more active range of motion to the neck and to see exactly just how far you're able to improve your mobility of the neck, okay? So lateral bending is very simple. You're going to try to touch your ear to the shoulder, but you don't want to lift the shoulder up, okay? It's just a lateral bending of the head. And you're going to go to one side, then turn around and go right to the opposite side. Okay? Now once you go through isometrics and a whole round of isometrics, this lateral bending maneuver here, you'll notice that you'll probably be able to bend your head a little further each time. Okay? And that's great because that's going to give you a lot of good range of motion and it will loosen up a very stiff neck. You'll want to do this particular move 10 or so times per side, so 10 times to the left, 10 to the right. Take a break and do another set of 10. Again, this move should not hurt. If you feel any pain in the neck during this maneuver, or if you feel any pain shooting down your shoulders or into your arms or hands, you need to contact your provider, okay? Or call us and ask us what's going on and we can take a look and see if things are okay for you to proceed, okay? Now the second part of this is after you've gone through your lateral bending is rotation. We very much turn our heads all day long. So being able to rotate the head without pain is important. So very simple. Start by picking a side and turning your head to that side. Okay. Not everyone has the same degree of rotation, but this is one way to work on how much you have and to improve on that. So when you go to that side, you'll just turn to the middle and then go to the exact opposite side. Very good. So, and then you'll repeat that 10 times to this side and then 10 times to the opposite. Okay, this is just rotation. We're working on each of these range of motions separately so that you can see which components of those you have a deficiency in, whether yours is deficient lateral movement to the left or right, whether you're not able to rotate your head to the right or left. These are things that we rehabilitate to improve on individually so that as a whole your neck has more mobility and more strength. Okay, this next move here is going to be extension with and without rotation of the neck. So what we do here is we have the patient lie with their head hanging off of a surface. So you let your head bend forward, McKenna. And you're going to work by extending your neck up, not using your mid back, but just using your neck. So you're contracting these posterior neck muscles, okay? So let's bring the head up, all the way into extension, and hold, and down. Now these should not cause pain. If they do, you might not be a candidate for these just yet, okay? So make sure that these aren't causing any pain when you go into doing each one. Let's come back up again. All the way up, and you shouldn't see the shoulders coming off the table. This is not a mid-back move. This is just purely a neck extension move against gravity. So it's a little bit more involved than just standard extension in the seated position. Now you can add something to this by turning the head slightly. We can activate a side of the neck. Now lifting the head up all the way during the rotation and all the way down. This will isolate the left and the right side of the neck. So let's turn the head to the opposite side. And now all the way down with it. There we go. Now lift it all the way up. Good. So she's strengthening the right side in the upper trap and the extensors in the neck here. You should primarily make this a neck exercise. Don't try to activate your upper traps, okay? But you can feel this muscle contract to a degree, okay? All the way down. Very good. This is neck extension with and without rotation. Okay, those following exercises that we just showed you are for the neck. Now there's some very simple basic exercises that you can do it right there at home. There are many more that you can do for strengthening and other ways that you can add a spin or a twist to them to make them more difficult. But we hope this gets you started in your rehabilitation program at home. And if you have any questions, please don't hesitate to call us.